Awesome. Thank you. All right. So let's go ahead and get started. We'll start with just a quick round of introductions. I'm Jamie Smith from the Southern California Coastal Water Research Project, and I am one of the co-chairs of the California Cyanobacterial Habs Network, our CC Habs Network. I'll just give a minute for my two other co-chairs to introduce themselves, and then we'll get started with our agenda. So Karen, you want to go first?
Yeah. Hi, I'm Karen Odkins. I'm another co-chair. I'm over at California Department of Fish and Wildlife. And I am the newest co-chair. And Sarah, oh yeah, she's here.
Morning, everyone. My name is Sarah Ryan. I'm the environmental director for the Big Valley Band of Pomo Indians and your third and final co-chair.
Perfect. Awesome. So we're excited to kind of bring you a fun agenda today. So I'll go ahead and stop sharing my screen. We usually start with our announcements. We had one planned kind of announcement item from Joe Westhouse. So Joe, I made you co-host. I didn't know if you wanted to share any screens or just pop on and discuss your item.
Good morning. Yeah, I do not see the invite for host, but I'll see if I can share my screen. I do have just a quick presentation if we got time for it. I believe you said you did. What's going on? There we go. I'm never in Zoom. I forgot how to use it. All right. That's not it. Is there? I'm not seeing a share. Oh, there it is. Never mind.
Maybe at the bottom, yeah.
Cool. And here we go. Okay. You guys see my screen okay?
Let's see. You're sharing, but it's black right now. Yeah.
Oh, now we're seeing. Oh,
awesome.
There it is.
Okay, it seems like there might be a delay, so I will make sure that when I change a slide, it shows on your side as well.
Perfect.
But real quick, thank you for having me. I am Joe Westhouse, an environmental scientist at the State Water Board, Division of Water Quality, and I'm a co-lead for the biostimulatory cyanotoxins and biological conditions provisions. It's been a while since I've been with CZ Hab to provide an update, maybe even over a year and a half at this point. So for those who do not know, my office, we write water quality standards or objectives that are then linked to beneficial uses that are assigned to water bodies. And when there are certain types of impairments and the beneficial use is not being met, it's my section that works with the regional boards to do assessments and try to get that water back to meeting beneficial uses. So a part of that process in our office is to write the standards that we then would like to comply with to keep our waters healthy. This one is the biostimulatory objectives or provisions project. So I apologize for being in PowerPoint. My computer seems to like that better than if I go into presentation mode. So we get to look at this nice controls up here as well. Just moving on to the next slide, hopefully. Okay, is that showing okay?
Looks good.
Okay, great. So as mentioned, I'm Joe, environmental scientist, State Water Board, and I'm just one of 10 of the staff and managers on the team that are developing these provisions. So we all work pretty closely together and pretty hard on this policy. The purpose of today is to really just update this network on the project and what's been going on, as well as share details about it as it has changed since last time I provided an update. It's an opportunity for you to ask questions as you find a need. And overall, it's really just like spread the word. So down the road, if you see your work applying to the upcoming or established objectives, it's an opportunity, or it's for you to know what's going on so you have an opportunity to reach out and we can leverage your knowledge or vice versa to work on our waters. The scope of our project it used to be one big project, but we realized that it was a little too big. So we've broken it up into multiple rulemakings, which is essentially of the State Water Board passing an amendment to our basin plans to make these objectives effective. So our first rulemaking would be a water quality objective for wadable streams for biostimulatory substances. And that would include total nitrogen, total phosphorus, but more applicable to the CCAB network would be microcystin, anatoxin, cylindrospermopsin, and those would be applicable to the REC1 and Mune beneficial uses for our inland waters. The project will come with implementation and monitoring requirements, and that is expected to be somewhat light for this round, and then a little bit, depending on the interest of the regulators and the public, or dischargers, or basically everybody. It'll come with more stringent requirements in the following rulemakings. And everything that we are doing with this policy, which I hope everyone should be aware of by now, is that all of our work is driven by established science, including the scope of the work. So what's driving the timeline is what already exists with the science that we have, and then components of the project where we're still fleshing out the science, those are coming in later rulemakings. The future rulemakings will, as mentioned, be applicable as science is developed and finalized. And it will include amending an existing beneficial use or establishing a beneficial use to protect dogs. There will be water quality objectives for other water body types, such as lakes, reservoirs, and estuaries. There will be a cyanotoxins objective for dogs and domestic animals as well. And then the cultural beneficial use will have the cyanotoxins objective be applicable to that as well within the policy. And then lastly, we would like to formalize bioassessment tools such as the CSCI and ASCI. The purpose of the project is to prevent biostimulation or eutrophication and cyanobacteria production, harmful algal blooms, and ultimately exposure to people, cattle, dogs, everybody, and to protect aquatic life. It's to mitigate the impacts of biostimulation in already impaired waters, to protect tribes and their ceremonial and cultural practices, as well as the participants. It is to prevent HABs and the overproduction of cyanotoxins. It's to protect water quality, human health, and domestic animals. And lastly, to serve as a regulatory enforcement tool to achieve all of these aforementioned goals just mentioned. So the current project or rulemaking is going to have total nitrogen, total phosphorus, and bottom or benthic chlorophyll A as the water quality objectives. Cyano water quality objectives are going to apply to REC1 and municipal beneficial uses, as previously mentioned. And then also, as previously mentioned, the program of implementation will be in effect as well. The status, so where we're at today. We've done a lot of research and vetted quite a bit of science, and we've got a general framework established or developed for this iteration of the project. We're currently in the middle of a series of regulatory advisory group meetings, which is ultimately pulling all regional board representatives, the right standards, as well as permit writers and ambient monitors. It's a diverse group of people, but they all come from the various regional water boards, and they're giving us the input on how to make this policy most effective based on their perspectives within their regions. So that should be ending soon, and then we'll take that feedback and then start working on the policy even more to accommodate what's been said during those meetings. I already covered water quality objectives. Let's see, considering other factors. Oh, okay, so in addition to the substances of total nitrogen and phosphorus, and then chlorophyll A as the drivers and indicators that we're seeking to use to either control or determine impairment, we're also looking at other conditions such as channel, stream structure, percent cover, and other non-chemical or other non-chemical constituents or variables that do have an impact on the health of the stream, or whether it's eutrophic or not. I think that's all I got for this slide. For engagement, we are doing outreach, as mentioned, with the regulatory advisory group. We have presented with the FHAB program, so this presentation may be a little bit familiar to you. And we are here with you at CCHAB. We're also engaging with stakeholders. We work with the Southern California Coastal Water Research Project and are often briefing our board and getting their input as well. As we move forward, we're going to continue those engagement practices, but also we're looking forward to reaching out to tribes and working with them and getting their perspective on this policy and seeing how we can better affect the waters to promote the health and their uses within those waters. And then, of course, the public, when we go into the rulemaking process formally, we'll be needing to inform the public and get their input as well. So that is my rundown on BioStim. Are there any questions?
Thanks, Joe. Yeah, we have time for maybe one or two quick questions. Yeah, Sarah.
Hi, Joe.
Hi, it's been a while.
Yes. You're working on some exciting stuff here, and really happy to see the work of this group. And I was interested in you have municipal as one of the beneficial uses. I'm not sure if you're familiar with the CalWatch program that Big Valley is working with Tracking California or the Public Health Institute with, but we've recently published on the private or self-supplied water systems and the cyanotoxin issues, and even the intact cyanobacteria. Coming out of the tap water of a number of homes that we've tested here on Clear Lake. And so I am wondering, when you're talking about municipal, I know that's public water systems and state smalls. Is there any attention being paid to these self-supplied systems that are on water bodies throughout California, and the lack of appropriate treatment for them? And if so, would that be factored into the types of requirements and objectives for ambient toxins?
Yeah, that's a good question. With me, yeah. So let's see. Our being that I'm in Division of Water Quality, a lot of the Mune is essentially focused on the water that feeds into the reservoir that does ultimately get to our drinking water, or is our drinking water collected. So we're more like in the nature realm, not necessarily in treatment itself. However, Division of Drinking Water, uh, I don't know if they passed the objective yet or if they're about to, but they're focused on this, and we're working closely with the Division of Drinking Water as we develop our side of the policy with regard to Mune. But definitely want to accommodate DDWs, which is Division of Drinking Water, accommodate their objectives and do whatever we can to maybe even support that on a regulatory level to ensure that protection is occurring at the standards that we need to protect health ultimately.
Yeah, and I would just recommend.
So I did make note though.
Oh,
Go ahead.
yeah, please. And I would just recommend if there's any questions that the group has about the cyanotoxins in self-supplied or private systems in our study, to please reach out to me. I'll put my email in the chat. But it was quite concerning to see what we were seeing here on Clear Lake.
Yeah, and I took a note as well for CalWatch and the cyano issues, self-supplied systems. But if there's anything you'd like to send me in that regard, I'll put my email in the chat as well. But I'll be sure to. I took a note, so I want to look into that as well and reach out to DDW to make sure they're aware. So thank you.
Awesome, thank you. So we got to move on to our next agenda item, but please, Joe, would you welcome emails and all of that if there's additional questions?
Definitely, yes.
Perfect.
So thank you all.
Yeah, thank you, everybody. All right, so next up we have Brian Brooks from Baylor University. He's a professor, and he's going to talk to us about a regional study that they did in Texas, looking across a variety of kind of land uses and precipitation regimes. So Joe, yeah, perfect. You got your screen up? Looks good.
Awesome. Thanks a bunch for having me here. And, as a native Californian, I'm always happy to engage topics in my home state. I'm trying to get this this screen projected full screen here. Just give me a second. So as Jamie was mentioning, we recently published a paper in ES&T led by a PhD student, Kevin Strosky. And before I go into that, I wanted to frame some of our motivation for the investigation. I'm not sure how many people have seen that paper, but a few years ago, some of the colleagues and I, including Meredith Howard, who's here today, hi Meredith, published a paper and was just asking a question, are these types of HABs becoming, maybe a bigger water quality threat than we might expect in inland waters? And so we started really kind of thinking about these issues. And, in Texas, historically, I've done a lot of work with Primesium parvum, an organism that some of you may be familiar with. Professor Karen obviously is. But these events are really tremendous, right, in terms of millions of fish in a reservoir that are actually impacted when a bloom actually occurs. And of course, it had primarily been studied in the coastal species or coastal settings, but of course we have a number of moderately saline inland waters in the state of Texas, and so this euryhaline species has been able to do quite well under certain conditions. So one of the approaches that we took when we started thinking about Primesium parvum were defining niche space, understanding conditions not just that cause the bloom to happen, but also the toxins production. Because when we started working with water resource managers, the conundrum at the time is that cell density doesn't relate to ambient toxicity. Now, with Primesium parvum measuring the toxins, robustly and quite frankly reliably is a challenge. And so then, of course, what else is happening in Texas, much like what you see, are blue-green algae or the cyanobacteria. Have been causing lots of challenges, and over the last few years we've been supporting state agencies. It's in analytical measurement of different types of cyanotoxins, some of your favorites, and of course here's some pictures from our colleague at Texas Parks and Wildlife. You can see the scums that are there, but dog deaths are common. One summer we actually had to close down multiple parks because on July 4th, nonetheless, because of really elevated levels of a number of antitoxins in those scums and associated dog deaths that were actually occurring. And so we know HABs are a big issue. We've seen this from some of our horizon scanning work around the world. This went on multiple continents, and so we see the topic showing up everywhere. Are we looking for it more commonly in terms of the cyanobacteria and other algae in inland waters? Are we improving our monitoring of toxins? Well, maybe not so much, but what is recognized around the world are questions like this. We really need to be thinking about mechanistic interpretation of environmental conditions, environmental gradients that trigger the production of the toxins, not just the presence of the cells. And as you'll see a little bit later in my talk, we've also been extending some of our earlier work with Primesium parvum, examining conditions, N to P, salinity gradients, temperature, other conditions, and studying how that may influence toxins production by both infixers and non-nitrogen fixing cyanobacteria. We also see, of course, from a broader public health standpoint and a horizon scanning exercise we perform with the Centers for Disease Control and Prevention that HABs are actually hitting the local health departments. And of course, California has a very different structure than somewhere like Texas, right, that has a very distributed model, and basically most of the responsibility for water quality monitoring rests at the local level. We see across the country that this topic is sort of falling through the cracks, and local health department folks that oftentimes are involved in swimming pool and spa investigations are actually now going to the swimming holes, so to speak, of reservoirs, other water bodies due to concerns of cyanobacteria exposures. A fellow that I worked with when I was in grad school was passed away in the last years, Tom Waller, and Tom used to always say, "You only find what you're looking for, only if it's present at concentrations high enough to be detected by the method that you use to analyze for it." Of course, we've got an Orbitrap now, and we know how to use it, and we can also look at non-target analysis, suspect screening of some of the compounds, and perform interesting studies of the environmental fate and bioaccumulation of some of these cyanotoxins. But the reality is, as you well know, the surveillance approaches are primarily microscopic in nature. And then, of course, we see use of ELISA kits for total microsystems. Obviously, the satellite imagery is really helping, but the use of specific, robust targeted LC mass spectrometry types of approaches is still quite limited in the literature. And that really brings us to the motivation for the study. And in this paper from a few years ago, we were really trying to think about overall how we perform surface water quality assessment, with the idea that, again, what we're seeing with some of the bloom events, whether it be from cyanos or Primesium parvum, these types of species in inland waters, that we may be seeing bigger impacts than what we would normally see from anthropogenic chemicals. We recognize that there's sublethal effects, and obviously it's another part of our research team's activities. But the core really under Clean Water Act is surface water quality monitoring and surveillance. Excuse me, at the cost savings here in our office at Baylor. And so, if we're involved with those kinds of activities, well, let's think about the hundreds and hundreds of reservoirs, right, across just the continental U.S. that are used for various types of recreation, fishing, water supply, agricultural activities. It's not surprising. I mean, California, Ohio, there are some places in the U.S. that have coordinated monitoring activities. That's why I'm so grateful to be able to speak with you today. That's not been happening in a place like Texas, where we really don't have any natural lakes. I mean, maybe we have one, but even that's been modified and diverted a bit. Our surface waters are largely these impoundments throughout the state that, have some flood control, obviously, provisions, but, make no mistake, we're developed for drinking water supplies and are heavily used from a recreational perspective. But we haven't really been looking for cyanobacteria in general, or the toxins they produce in particular, in our surface water monitoring activities. But of course, people are using, right, these reservoirs, and the waters are actually being used in agriculture. And we also see aquaculture activities that continue to increase, especially along our coastline, both for freshwater and estuarine species. And we're intensifying shellfish activities in terms of aquaculture along the coast of Texas right now. So we developed a few years ago a targeted method for some of your favorite cyanotoxins. I say this is a method. To be fair, there's two different types of separations that are used, and so we basically use a more traditional C18 type of reverse phase chromatography column for the microcystins and nodularin, and then for anatoxin A and cylindro and saxitoxin, we use this Helix Z column, which was pretty new at the time and really helped us. There were some standards, some label standards that had become available, and some of the take-home messages, I think, from this paper that are relevant, especially since we were working with some of the manufacturers to really test drive some of the new label standards at the time, is that there are matrix effects that really need to be accounted for in terms of ion suppression and such, whether you're looking at tissues of fish, if you're concerned about consumption, or if you're looking at just routine surface water monitoring of scums or even samples with depth. So again, our motivation for the study is that most of this is actually quite rare, right, in inland waters around the world, and with a few exceptions, that's certainly the case here in Texas. But we think about essential services, okay, of public health and intersections with the environment. This is an older figure. Obviously, the newer figure basically has equity at the center, right, of this, so to speak, wheel. And at least the way I view the world from a public health standpoint is that if you have a problem, it's generally because one or more of these essential services are not being effectively, efficiently, and equitably delivered to local communities, right? Of course, monitoring health status, environmental factors, diagnosing, investigating, and selecting appropriate interventions are the two essential services of assessment. So really our motivation here is that we haven't been delivering essential services in surface water bodies that are used by millions of people for drinking water supplies, recreation activities every year. So this is Strasky. He gave the poster actually at the GRC in Italy this last summer, so good for him. And then the paper obviously came along, but Schlink, this is Dan Rolke, our long time collaborator, who's now at Texas A&M Galveston. So it was a partnership. Dan was working on a project with Corps of Engineers colleagues in Vicksburg, and some of the limno and metagenomic work appeared late last year in harmful algae, and there's some additional analyses, so you probably see some additional papers from this effort coming forward in the next 12 months. So this study was not really a limnologically focused effort in terms of the Strasky et al. Paper. It was simply thinking about the way that we examine surface water quality. And so, look, Texas is a large place, much like California. And what has happened historically is for surface water quality monitoring activities, these occur primarily, if they occur, during a critical monitoring period, which is in basically late summer months. And that goes back to long-standing perspectives of, dilution paradigms, right? Solution to pollution is dilution. In Texas, drier conditions tend to be found throughout the state during the later summer months, and thus the contaminant load from point or non-point source would be expected to be higher, right? And so that's really why it's focused in that area. But again, the extent to which any river, reservoir, estuary, for example, is examined is based upon a number of assumptions. Is someone doing the work? What are they looking for? How often are they doing this? That information, if they meet various types of quality considerations, are integrated into a surface water quality monitoring, basically information system, which then feeds into the 303 types of listing evaluations if the exceedance probabilities are high enough over the period of the multi-year monitoring efforts. So there's a lot of assumptions, right? But what is unique about Texas, there's a lot of things unique about Texas, I realize this, but one of the things that is really fascinating is that, in El Paso, you get this much rainfall per year, and in East Texas, it's representative of what you might see in the southeastern United States. So you have this dramatic rainfall gradient. And of course, some of you have probably seen some of the work that's been published in the last number of years suggesting that this 100th meridian or national dry line, which is historically, the 100th meridian be found here at the westernmost edge of Oklahoma, the border with Texas, has actually shifted with climate change to the east 150, 180 miles, perhaps in practice. And so the projections we've seen 2 decades ago of the drying in the American Southwest obviously is occurring, and we see that in Texas. So we selected these reservoirs across a really pronounced rainfall gradient. Now, when the monitoring occurs during these critical monitoring periods in the summer for various types of water quality parameters or indicators, it's happening at the surface, defined as a 0.3 meter depth, or in practice, it's elbow depth, with grab samples. And it's focusing on the near dam or near the impoundment, and the thought is, it's close to drinking water intakes. Of course, we all know that drinking water intake structures are located greater depth than 0.3 meters. And they're also not always located at the actual impoundment site itself. Many examples of mid-lake types of drinking water intakes. And so in this study, what we did is we selected these reservoirs across a pronounced rainfall gradient, and we sampled both at the main lake or near the dam site, the true lacustrine type of condition, which would be characteristic for most of these reservoirs. Although in the springtime, if there were lots of rain, you might see actually, the riverine zone of a reservoir really extend through almost to lacustrine conditions in some of these run-of-the-river reservoirs. But when we were sampling, that was not the case. So you truly had more lacustrine types of conditions. And then we selected a 6-meter depth mid-lake site in each of these 20 reservoirs. Now, what we did is we didn't just sample at the dam, we sampled at the mid-lake site, and we didn't just sample at the surface of the 0.3-meter site, we also sampled at depth. The idea there was it may be more reflective of what you might see at lower depth for drinking water intake. And then, of course, we also sampled not just during this critical monitoring period, but we sampled in the springtime. What I didn't mention is that some of the blooms that we're actually seeing are happening earlier in the year. And dog deaths, some of the work that we've done supporting our colleagues with the state agencies, having been in January, February, right? So, from a cyano-HAB perspective, you've got some temperature, nutrient, and stoichiometric relationships here that are actually quite fascinating and relevant in terms of the practice. We utilized basically the base method. We did some uptake or some updates to it to add in some additional antitoxins, and then also had some interference stuff that we worked through in terms of updating our previously reported methods. We also used ELISA kits for total microsystems direct from the manufacturer. I'm sure you're familiar with these. And then based upon the observations that we collected from the field, we performed these probabilistic hazard assessments, which are built upon developing probability-based exposure distributions and then examining potential exceedances of existing criteria or guideline values from states, federal, or international agencies. Sure. So, if you just compare the 5 microsystems that we measured, okay, with the LCMS-MS, and if you took the sum of those observations, and then if you compare that to the estimated, total microsystems, it's different, okay? And of course, the detection limits, we use the ELISA kits exactly as they came from the manufacturer. We didn't perform any solid phase extraction to try to push down their ability to pick things up. The advantage, of course, of ELISA kits, less expensive. You don't have to have an LC triple quad and know how to use it and keep it updated, all these kinds of things. And perhaps you're picking up other microsystems that are not being detected in the targeted method. However, it doesn't tell you anything about the individual congeners of microsystems. And I think this is really important from a toxicological perspective because the congeners can have quite different toxicological relevance and different molecular initiation events within an adverse outcome pathway context. Some of these compounds have endocrine disruption characteristics, for example. Some of the observations that we see are actually kind of interesting in terms of cylindrospermopsin, right? Which, of course, not picked up by your microcystin types of screens, but we did pick up cylindrospermopsin in 34% of the samples, and so that you basically just have a concentration on your y-axis and then categorical, labeling of the different reservoirs that we examined, basically from west to east in both of these figures. But the short of it is that so you do see some exceedances of some of the Oregon levels, which are fairly low. Texas levels are relatively high, at least right now, and so no detections exceeded those values. If you look at the microsystems, and these are basically environmental exposure distributions of different congeners, what becomes kind of interesting is that we did detect microcystin LR most commonly, but the highest exceedances were for microcystin YR. And we would actually observe specific congeners that were only found in specific reservoirs. So a congener may be dominating basically our observations, and LR wouldn't be detected in all locations. So it's actually quite interesting because, of course, you're not going to pick this type of information up with your ELISAs But I don't think that we can rely on ELISAs to, quite frankly, help us think about the individual congeners. And it's not rocket science, it's just the reality of the methodological detection assumptions. But, as the toxicology information continues to become available for congener-specific information, I think this is actually an area that we need to be keeping our eyes on, especially since we're seeing some of our highest exceedances by some of the least studied congeners that are in this group of toxins. Now, we were not sampling, or this is more of the microcystin data, so of course we look at this by season, by reservoir. So what is interesting is that we do observe higher exceedances of that Oregon canine value. For, again, the total microcystin concentration here is just the sum of the 5 that we quantified, if in fact we quantified all of them. Okay, so that's what we're plotting here on the distributions. The exceedances are higher in the spring than the summer. So during the period when we are not currently, and we're not generally performing routine cyanotoxins analysis using any type of method across the reservoirs in this state, but in the springtime, right, when surface water quality monitoring activities are, quite frankly, not really common in general, the highest exceedances are actually observed at those times. We also see slightly higher exceedance of this Oregon canine recreation value at these mid-lake sites, right? And so, on one hand, that's a low value relative to, say, some of your WHO numbers. On the other hand, I think it does illustrate that we may need to be thinking about our monitoring activities to be tailored perhaps to areas that are associated with specific types of uses. Our local reservoir and water supply in town, for example, has, beaches, right? Okay, we're a 3.5 hour drive from the Texas coast, and even then, it's not the same thing as the beaches you have there in SoCal, Jamie. But the reality is that there's a lot of people that utilize these sort of beach areas in the impounded locations. And so how do we start thinking about these considerations? We did detect the microcystins at depth, right, in these bottom samples in both of the main lake and mid-lake sites. And so this is interesting. Again, I think it's a limited data set. We've got to keep that in mind, but certainly perhaps the distribution in the water column is something to be thinking about relative to intake structure location. So we do pick up some antitoxins. We don't see any exceedances, but keep in mind we weren't sampling the scums, right? This is a 0.3 meters subsurface sample, right? So this would not necessarily be picking up those higher levels like I was mentioning that have actually shut down recreational activities in state parks in the last few years. And we did also observe some, as I mentioned, some of the cyanotoxin exceedances for cylindrospermopsin and saxitoxin. So the basic synopsis here is, look, I mean, the levels that we observe are below some thresholds that have been established. And the current situation, as some of you know, I mean, obviously EPA is now kind of just developing a HAB office and Office of Water. It'll be interesting to see how that works. Really appreciated the conversation, given by the colleague with his presentation earlier today with the work that you're doing in California along the sort of criteria and guideline derivation process. We do have limitations in terms of the toxicology information for some of these individual congeners that are being examined, and certainly, I mean, the other antitoxins we're examining have, make no mistake, biologically relevant activity, and but again, there's not a ton of really robust toxicology information, and the quality of the toxicology information, as Jamie knows, you might be from the aquatic toxicology information specifically. You might be interested in Alvina Mijento's paper from a couple of years ago. Some of you were involved, that really kind of focused on microcystins, but it's not any better, to be fair, for the antitoxins and cylindrospermopsin in terms of the quality, the inconsistent reporting of the purity of the compounds that are being examined, experimental designs that don't meet the expectations for just criteria development. And so I think we need to be mindful of all that. But regardless, our synopsis was that if we fail to consider, which of these, cyanotoxins are being examined, right? How we're actually measuring cyanotoxins, right? Well, clearly, lysa kits are useful. Tell us nothing about cylindrospermopsin, okay, which has a different mechanism of action than any of the or the microcystins that we know. I mean, it's certainly different than saxitoxin or the antitoxins. And we also need to be thinking about when and where we actually take those samples, right? Because they'll influence our water quality assessment and perhaps intervention management activities for public health and the environment. And so, Jamie, I think I'm just about out of time, but I'm happy to stop here and take some questions or whatever you prefer. Again, thank you all for giving me the opportunity to share some of our thoughts today.
Yeah, thank you, Brian. I think we can take a couple questions if there's any from the group. Dave Karen says, "Hi, Brian. Great talk," in the chat.
Dave, you're too kind. Mike, Paul.
Mike, yeah.
Hey, Brian, that was a great synopsis. I had a question for you on the depth stuff. Given the, notorious vertical migration of some of these taxa, I was surprised we didn't see a difference there. And I was wondering if you guys did any diel measurements to sort of recommend the best time to surface 0.3 meters, if that's what the agency is going to do and we're stuck with it. What's the best time for them to sample at 0.3 versus the depth that they can?
Mike, it's a great question. We really consider this a pilot study. We were leveraging some of our support through NIHS's Ocean and Human Health Center program, along with some of the support from the Corps of Engineers to be able to pull this off. It was a really, I think, good opportunity to leverage resources and of course, especially building upon some of the observations that we were observing during the course of our center grant. In terms of the way that we were supporting local decision-making of water quality management and public health agencies. And so, no, we didn't do any type of assessment of, integrated water column or additional fixed depth or diel types of activities. And your point is very well taken. But again, our exercise here was somewhat, we consider it more of a pilot project, right? But regardless, samples are taken during the day, but regardless, I mean, I think our observations are actually quite clear, is that, maybe this critical monitoring period was a pragmatic approach, right? It's a large state. There are thousands of river miles, and we don't have a lot of staff allocated. Just our kills and spills biology team with Texas Parks and Wildlife, oftentimes one person is responsible for dozens and dozens and dozens of counties. Okay, we have 254 counties in the state. And so, the surface water monitoring activities in Texas are also shared among different these pseudo-state agencies like river authorities. They have a Clean Rivers program, but I'm not familiar with any coordinated activities by the river authorities or the other state agencies. So I applaud what you guys are trying to do in California in terms of keep people, connected, discussing the need, because, if what we're seeing, which suggests that with climate change and some of the stoichiometric influences, which I haven't gotten into. We published a number of papers if you're interested in how stoichiometric conditions influence. Yeah, we can make certain cyanobacteria make more or less toxin, okay? And there's some subtlety in terms of whether or not you can fix nitrogen, right, with other conditions. So yeah, if these blooms are actually happening, and if they continue to happen earlier in the year, then if again, it's out of sight, out of mind. So, back to Tom Waller's quote, if you're not looking for it in the spring, if you're not looking for it with the right kinds of tools, then you've just missed basically the impacts or the potential risks that you should be managing to public health and the environment. And so we're not delivering our essential services. And, the way I read the provisions of Clean Water Act, we're not doing what we're supposed to do in terms of, you know, these are toxic substances and they're present in toxic amounts. Thank you for the question.
Thank you so much, Brian. I think we'll go ahead and move on to our next agenda item. But if you want, you can put your email in the chat if anyone has questions.
Yeah, more than happy to chat. We remain quite engaged in this area of activity, and I'm sorry that I can't continue on. As I was mentioning to Jamie, we're hosting Dan Villeneuve from EPA in Duluth today for a seminar, and then he was in yesterday for a PhD student's defense. And so now I have to go back to my real job, but I'm grateful again, Jamie, for the opportunity. So thank you. Let me know if I can chat in any way.
Thank you, Brian.
Best wishes.
Awesome. All right, so our next speaker is Jordan Murray from Wisconsin. She's a HAB epidemiologist. So Jordan, if you're ready to go, I know I messaged you that we're going to start a little late, but if you want to start, pull your screen up and everything, we can go ahead and move on to your presentation on looking at respiratory related health impacts in relation to harmful algal blooms. So I will pass it off to you.
Sure, yeah, thank you. Thanks for that introduction, and thank you for having me today. I'm sitting here in cold Wisconsin, definitely wishing I was in sunny California right now. So definitely, definitely jealous of you all today. But yeah, this project that I'm going to talk about today was a long time in the making, so I'm really excited to share it with you all. Starting off with just a little bit of background, it's pretty well understood that harmful algal blooms are an emerging environmental and public health issue. We know that animals and people can become sick if they're exposed to cyanotoxins. And while we've come to learn a lot about these illnesses over the years and are continuing to learn more with new research coming out all of the time, these illnesses can be pretty challenging to study. And because of this, some aspects of them are still not fully understood. And there are a few limiting factors to studying cyanohab illnesses. A few of them, including illnesses, are often underreported. So I'm not sure how severe this issue is in California, but in Wisconsin, and I know other states as well, HAB-related illnesses are not always reported to us. And we've come to learn that there's a pretty big gap in knowledge among the public. So not everyone is aware of what HABs are, what they look like, and what sort of symptoms they can produce, and let alone that they should be reported to the states. We've also come to learn that the level of HAB-related knowledge among medical professionals can vary pretty considerably. So if a person goes into the doctor for what they think is a HAB-related illness, it's not guaranteed that the doctor will recognize and diagnose the illness as HAB-related. And then on top of that, there's currently no commercially available diagnostic tests that a doctor could run on a blood sample, for example, to determine an illness as HAB-related. And I'm sure a lot of you can relate to this one, but yeah, research can be expensive. Ideally, we would love to have tons of funding to pay for biomonitoring studies where we can, test blood or urine for cyanotoxins after people were exposed to a bloom, or in people living around a lake experiencing HABs. But sadly, we can't yet, but I'm hopeful for the future. And then water quality data for cyanobacteria is pretty limited across the board. We don't have consistent long-term real-time cyanobacteria and especially cyanotoxin data because that also takes money, time, and staff. And as Brian mentioned, a lot of monitoring efforts take place at the local level, which can be challenging without, again, the money, time, and staff. And so it might be a while before we can overcome these barriers and create the perfect study. But in the meantime, there are other more attainable methods and tools that we can use to study the relationship between HABs and health. And these include large-scale population-based epidemiological studies, including health data. environmental data that might not be real-time collection and testing, but using other databases that are accessible. And lastly, we can also use a diverse team of scientists who love studying HABs. And thus, the cross-agency Cyanohab and respiratory health pilot study was born. So this project has been a huge team effort. It required the expertise and specific skill sets from researchers across all different agencies. So our team consisted of very talented and intelligent people from the CDC, EPA, NASA, NOAA, and USGS. And so today I'll talk about why and how this team designed this study and then its significance to the field of HABs and health. Just for some context, about 2 years ago now, the HAB program here at the Wisconsin Department of Health was approached by CDC epidemiologists Lori Baker and Amy Lavery to collaborate on a pilot project about HABs and respiratory health. And the idea behind this project was to explore the concept of aerosolized cyanohabs and how/if they cause health effects in people. And this paper was published back in January, and happy to provide a copy of this paper to anyone who's interested. Our project focuses on respiratory illnesses that result from inhaling aerosolized cyanobacteria and cyanotoxins. Now, we do have a few decades of research that do study this relationship, but there is a large need for more information about how aerosolized cyanotoxins and cyanobacteria affect respiratory health. A lot of the current research revolves around marine toxins. There have been cohort studies on Karenia brevis blooms along the coast of Florida that have identified human health effects from aerosolized brevetoxins in marine and coastal algal blooms. In these studies, they found that both healthy populations and people with asthma reported symptoms like respiratory irritation that lasted for days. And then on the clinical side of things, cyanotoxins have been observed in human air and nasal passageways. Specifically, microcystin has been detected on nasal swab specimens of people who were in direct contact with water experiencing blooms and people who were just near water experiencing blooms. And then in animal studies, airway inflammation has been observed after controlled exposure to cyanotoxins. We also have national surveillance and anecdotal reports about respiratory related symptoms like sore throats, nasal congestion, and runny nose from states who collect, investigate, and report bloom-related illnesses to OHABs, which is a federal surveillance system specific to HAB illnesses. In California, Wisconsin are both states that report to this surveillance system. This is a graph from their 2021 health summary report. Although, as I mentioned, because of the underreporting issue, it's likely that there are a lot more illnesses than the ones shown on this graph that are just not being reported. Then to supplement the health data, we also have environmental data like toxin concentrations that were measured in the water and ambient air of a blooming water body. And the environmental data has been really helpful in contributing to the validity of the health data. And so while we know that there is some type of relationship, there are important aspects of this relationship that we need more information about. So similar to other HAB-related illnesses, we don't know how frequently people are being exposed to aerosolized cyanobacteria and cyanotoxins and getting sick from inhaling them. We also don't know how significant or severe the symptoms can be, whether they're more mild in nature or bad enough to warrant medical attention. And then on top of that, we're lacking information about what populations are most susceptible to exposure and associated illnesses. And more specifically, we don't really know how exposure to cyanohabs affects population health, specifically for people who live around a water body that frequently experiences HABs. A lot of the epidemiology studies that I just mentioned that assess the relationship between exposure to cyanobacteria blooms and associated diseases can be costly, they can be time consuming, and they rely on naturally occurring bloom events, which can be pretty unpredictable. And so with the implementation of this pilot project, we really wanted to know if there were other ways besides the current strategies and studies that I just reviewed to explore the relationship between respiratory health effects and cyanobacteria cyanotoxin exposure. So what environmental and health data sources exist already, and can we use them to better understand this relationship? And if we can use them, then how do we use them? And so our team began by exploring different types of health-related data sets. We looked into the National Poison Data System. We looked at syndromic surveillance, and we also looked at insurance claims data, but we ultimately decided that electronic health records may be a source of data that we could utilize for a study. These are a low-cost way of accessing longitudinal data on large populations. And to our knowledge, very few studies in the current HAB literature use electronic health records to study health outcomes. So it really worked out in our favor that Wisconsin had a robust electronic health record database that we could use. So we then started looking at what type of HAB data is available and routinely collected. We really needed data that was collected routinely throughout the year to be able to run some of the statistical models that we were planning. So we looked at lake monitoring data collected at states, regional, and local levels, as well as what sort of data exists at the federal level. And then we decided that our safest and most practical bet was probably to use remote sensing data. And so once we narrowed down and finalized what data sets we wanted to use, we were able to begin our study. And so bringing it all together here, our objective was to use electronic health records to explore the relationship between the occurrence of harmful algal blooms and the frequency of respiratory-related healthcare visits for people living near a freshwater lake. And so in a time series analysis, we compared respiratory-related healthcare visits to harmful algal bloom occurrence from 2017 to 2019. We aggregated hospital visits and HAB data by week. And then we created regression models to measure the association between weekly counts of HAB data and health visits. And if you're not familiar with what regression models are, they're basically just a way to study the relationship between an exposure variable and a disease or outcome. So in this case, the exposure variable is cynohabs, and the disease or outcome is respiratory hospital visits. And then lastly, we adjusted our models for covariates, or we looked at any type of variable that might impact the relationship between cynohab occurrence and hospital visits. For our study region, we wanted to look at a water body in Wisconsin that experiences frequent and annual blooms in the warmer months. So we narrowed it down to 3 different regions and decided on looking at Green Bay for the first part of the study. The lower Bay region pictured here is a lake that blooms fairly consistently, and our population of interest was residents who live in zip codes within a 3-mile radius of that lower Green Bay region. And moving on to the demographics of our Green Bay residents. So in total, there were 2,743 individual hospital records that we identified. Males and females were almost equally distributed. And in terms of age, 35% of the sample were younger than 19, while 65% were 19 or older. Most people were white and non-Hispanic, and in these data, it was interesting because we actually saw more Black and Native American populations seeking respiratory-related healthcare than we would expect given the local population makeup. investigating these differences. It wasn't one of the main aims of this specific pilot study, but they are important to acknowledge, and we do plan on looking at them more carefully in future analyses. So moving on to our health data. So our hospital data was provided by the Wisconsin Hospital Association Information Center, and this agency sends hospital data from most hospitals in Wisconsin to the Wisconsin Department of Health Services. And relevant to our study, it includes all sorts of data like patient type, so inpatients, outpatients, and emergency department patients. And then in these data sets, each of these patients can have up to 8 diagnoses when they come to the hospital, which again, relevant to our study. But we then searched the hospital data set for a specific list of respiratory related ICD codes. And if you aren't familiar with ICD codes, it stands for International Classification of Diseases. These are just codes that healthcare workers use to classify a patient's diagnosis, and they're also used for insurance purposes. So we searched for codes that were related to asthma, wheezing, and allergic rhinitis. And for the purposes of our study, we only looked at patients' primary diagnostic code. We didn't look at the other 7 of their potential diagnostic codes, so just the first one. And then this is a graph of the hospital visits for the year period 2017, 2018, and 2019. And when you look at the frequency of these healthcare visits over the course of the 3 years, we can't really extrapolate much from this graph other than that there are some seasonal patterns like peaks in the late summer and early fall, and then some lulls in the winter months. And for our cyanobacteria data, as mentioned earlier, we decided to use remote sensing data. This was because, again, we really needed a data set that was longitudinal and had consistent, repeated measures over time across the US. And so we turned to our colleagues on the Cyan team who created the Cyanobacteria Assessment Network. As many of you are probably familiar, Cyan is a multi-agency collaboration between EPA, NASA, NOAA, and USGS. The aim was to develop an early warning indicator of algal blooms in freshwater systems across the US. The satellite images and processing algorithms are able to assess the color of the water to estimate the values of chlorophyll in the water body, and then give an estimate of the abundance of cyanobacteria in the water. And this abundance of cyanobacteria is also known as the cyano index. In this image, you can see the different pixels within this water body that are detecting bloom activity. The lighter green going to red indicate a higher cyano index. Gray means that the pixel of water body did not detect cyanobacteria, while the black indicates that no data are available because of cloud cover or because the water body might not be large enough at that location. This is the week of data we looked at in 2018 using Cyan. The blue column in the graph shows the percentage of pixels in the Green Bay study area that detected a bloom. The percent of pixels goes up this week to about 96% of pixels showing detects of a bloom. You can also see that the cyano index values go up as well, seeming to peak with the most red during the middle of the week. And then the orange line in the graph shows the median chlorophyll A values that the Cyan algorithm provided for that week. For the most part this week, we can see that the median chlorophyll A values are trending with the bloom pixel detections, which is also representative of the percentage detects. This week in July of 2019 was a little different. You can tell from the images that less pixels were detecting blooms earlier in the week. However, the median chlorophyll A value was higher than in other areas, despite more pixels detecting blooms. This was interesting to us, and we thought this was an important point to consider. There were obvious outliers in our data. In March of 2019, there's a very high value for the estimate's chlorophyll A value, which seemed out of season, especially for Wisconsin. The image here shows the cyan data from that week. And what happened was there were these little blips showing detect values in the lake. But we think that these were likely errors, or there were items in the image that were skewing the color in those areas that were unrelated to bloom activity. We further looked into the count of pixels detecting bloom in comparison to the median chlorophyll A values. This helped us assess whether there were many pixels involved in the bloom or if just a few might be contributing to the value. And as you can see labeled here, our spot on March 2019, very few pixels were contributing to that high value. In contrast, the higher chlorophyll values seen in the summer months were more consistent with the higher values. And so based on this information, what we decided we needed to do was create a reliable metric with this data that would essentially approximate potential exposure to cyanohabs. So we ended up developing a weighting metric that took into account the number of pixels that were detecting bloom in the study area and the median value of chlorophyll A value that was developed by the cyan team. And so just to lay out the weighting method here and how we calculated it, basically we took the total percentage of detection pixels minus the pixels with non-detection. For each week, the total number of detection pixels were divided by the total number of pixels in the study area. And the median chlorophyll A value for the week was multiplied by this percentage to get a final weighted value. This weighting, it really helped to adjust for skewed pixel detection counts by helping smooth some of the values where only a few pixels were contributing to the value. And so overall, the pattern of data remained constant, showing typical bloom season patterns. For the weighting, we considered no data to be missing. If a week had more than 40% of pixel data missing, we excluded that week's worth of data. This was for the most part during the winter months, but there were some weeks during the summer of the 3 study years that did have to be excluded. And so if you have questions about the cyan data and methodology or just about the weighting equation, I would highly encourage you to either read our paper or reach out to one of our other project members, either Blake Shaper, Bridget Seegers, or Amy Lavery. I was the primary lead for the health data. These people were the masterminds behind the cyan data and methods, and can probably answer your questions about cyan data better than I could. So now I'll show a comparison between our health data and our cyan data. So when we compared our chlorophyll A values to our respiratory hospital visit records, we actually didn't see any sort of apparent relationship between them, which was sort of a bummer, but the relationship was explored later in our regression models. And when we were creating our regression models, we decided that our data might be easier to analyze and interpret if we categorize our chlorophyll values rather than leaving them as a continuous variable. And to categorize these values, we utilize the 2021 guidance created by the World Health Organization for recreational exposure to cyanobacteria. This guidance classifies an alert level framework based on chlorophyll concentrations in cyanobacteria dominated blooms. And these guidelines are pictured here with the lowest levels of chlorophyll in blooms characterized as no or low risk to health, and the highest level, or alert level 2, characterized as the highest risk to health. And here is the distribution of our chlorophyll values within the WHO categories. And as you can see, most of our weekly chlorophyll values fall within category 1, which is the lowest risk level. Like I mentioned in the beginning, we used Poisson generalized linear models to estimate the association between weekly counts of HAB data and hospital visits with cyanobacteria being the exposure variable and hospital visits being the outcome or disease variable. And here's a little visual representation of our model. And creating this model, we really had to think about how other variables would affect the relationship. So what would our covariates be? What factors would impact the relationship between respiratory hospital visits or cyanohab dispersion or exposure? And so we considered things like temperature, seasons, dew points, school week, year, pollen, and air pollutants, including sulfur dioxide, ozone, and fine particulate matter. And so I'm sure some of you are thinking, well, what about wind? Initially, we did not think that wind in the context of our study would be impactful to our model. And this is because we would have had to aggregate wind data by week, since our other variables are aggregated at a weekly level. And since wind direction and speed can be vastly variable on a daily basis, we didn't think that wind values aggregated by week would be informative. But we did actually end up looking at these weekly aggregated wind data, and we were able to confirm that there actually was little variability in wind direction during our study period. And then on top of that, the winds were not blowing in the direction of densely populated, excuse me, in the direction of densely populated areas most of the time during peak bloom season. And so after all was said and done, this is the model dynamic that we came up with. We ended up including temperature, year, dew point, and season. Not surprisingly, temperature ended up being super correlated with chlorophyll values, and interestingly, dew point was also highly correlated with chlorophyll values. The top table here shows our unadjusted model, and the bottom table shows the model that we adjusted for temperature, year, season, and dew points. In both the unadjusted model and the model adjusted for season, year, temperature, and dew point, there were no statistically significant evidence of an association between our chlorophyll values and respiratory hospital visits. So yeah, no significant results, unfortunately. Sorry to disappoint. But just because we didn't see any significant associations, this doesn't necessarily mean that there isn't a relationship between cyanohabs and respiratory hospital visits. We had a few limitations which could have hindered our results. So we had a pretty small sample size. We only had 114 weeks of data. We also had low power, which was not high enough to distinguish between the effects of our cyan data and the effects of the confounding variables, temperature and dew point. But despite, significant results and study limitations, our research is still important. To our knowledge, this is the first study that was able to use two existing data sources, cyan data and electronic health records, to compare respiratory hospital visits to cyanobacteria biomass occurrence over time and at a population level. And we're also doing this again. So we're currently expanding this project to look at two more water body regions in Wisconsin, the Madison Chain of Lakes and Lake Winnebago, which is the largest inland lake in Wisconsin. These bodies of water are pretty infamous in Wisconsin for their bloom issues. And this is exciting because we'll have a larger sample, which should increase our power. And if power is high, it should counter the effects of temperature and dew point. So hopefully overall our model will be stronger and it will improve. This next phase of our project, it'll also give us the chance to refine our methodology and fix some loose ends. So the larger study, it should hopefully tell us whether or not our model works and is a good way to study respiratory health and just health outcomes in general, or it'll tell us that maybe this isn't the best method for studying the relationship between HABs and health. But either outcome will be insightful, and we're excited to see what this next study will bring. And yeah, that is all I have for today. Thank you so much for listening, and I'm happy to answer any questions at this time.
Thank you so much, Jordan. We'd love to take any questions. It looks like we already have one. Thomas, if you want to ask your question.
Sure. Thanks, Jordan. Yeah, thanks for an awesome presentation, Jordan. I just had a couple questions regarding the modeling. I was curious what type of regression you folks used, and then additionally, if you folks thought about incorporating any lags into the model as well.
Yes, we did a Poisson linear regression model, and we did look at lags within our model. We did a 4-week lag, and then we did a 1-week lag between respiratory hospital visits and cyanohab occurrence. And in doing these lags, we didn't find any statistically significant results from doing them, but definitely were important to include because at one point we were thinking you could be exposed to a cyanohab, and then you might not see results, or you might not go to the hospital for symptoms until like a week later. So that's one of the reasons that we considered including that 1-week lag, and one of the reasons we thought that was important to our study.
Awesome, thank you. Also, is there a reason you chose to use a Poisson linear regression generally? I think Poisson makes a lot of sense. I was just curious.
That's a good question. We had a CDC epi expert who ran all of these statistical models, and I can get back to you with that answer. I don't have that question.
That'd be great. I had done some wildfire research in the past, and we did a similar thing where we mapped the relationship between particulate matter and estimated increases in cardiovascular or respiratory emergency room rates. So kind of similar in terms of method, but we really used a Poisson regression. Except I think it was a conditional Poisson. It might have been logistic regression. But yeah, I was just curious. Thank you again. This is really interesting.
Yeah, thanks for your question.
Awesome, thank you. We have time for maybe one more question if anyone else has questions. And oh yeah, Sarah, go ahead.
Hi, Jordan. Super interesting study. Do you think with doing this again, will you potentially look at phycocyanin instead of chlorophyll A? I don't know if the cyan collects that, but that's a better, that's the pigment that's produced by cyanobacteria. And or using toxin data. Are there no monitoring entities out there in those water bodies you're thinking about who have that?
Yeah, I don't think we are including that in this next phase of our study. We're continuing with our methods that we have been using. And then in terms of toxin data, that's a great question, and it's definitely one of the limitations to this study is not having toxin data to compare to our satellite data. But unfortunately, in Wisconsin, we just don't have that sort of data available yet. I know there's a lot of ongoing monitoring efforts to be able to collect that toxin data, but again, due to like lack of staffing and program capacity at the local level and money, we just aren't able to collect that toxin data yet. But again, hopeful for the future, because that would add a lot of validity to our study if we could have that toxin data.
Well, I do want to say on Clear Lake, we did do a review also of emergency room visits for, I think it was those medical codes. And we have cyanotoxin data to compare it to, because there is a ongoing efforts throughout a number of years conducted by the tribe I work for toxin analysis. And we came up with similar results. So looking at multiple years of data. Yeah, so
that's reassuring.
The respiratory might not be where these things are happening. I don't know.
But interestingly, I'm at the State Health Department, Wisconsin, and we get a lot of health reports from the Green Bay area, people experiencing respiratory related issues, and we get direct reports from residents around that lake experiencing like respiratory issues, and whether that's cyanobacteria or maybe a secondary compound that's produced by cyanobacteria, we don't really know, and it's really hard to measure that. But we were hoping that the study could kind of get an overall picture of that relationship. But did you look at asthma, wheezing, allergic rhinitis, or did you just do like respiratory hospital visits in general?
Let's see. I don't have that specific information because that part of the lead, that lead was conducted by Tracking California. We're in a joint project together, but
Oh, sure.
I'll follow up with you and
Yeah,
we can answer those questions because yeah,
yeah,
it's exciting to see what you've done and how much you've put together. So I want to make sure that we all have that information. Yeah, we'll definitely.
yeah, definitely
We
follow up.
can.
That'd be great.
Yeah,
Thank you.
thank you.
Awesome. Thank you so much, Jordan, for joining us and sharing your work. If you want, you're welcome to put your email. So if people think of questions later, they could contact you. And we really appreciate your time and look forward to maybe hearing in the future how your follow-up study goes.
Yeah, thank you so much for having me today. Appreciate it.
Yeah, thank you so much. Okay, so moving on to our next agenda item. I know we're running a little bit behind, but this one should actually take less than the scheduled amount of time. But the co-chairs have a couple of kind of just CC business items for you all. So the first is letting everyone know that Sarah and I are reaching the ends of our terms as co-chair. And so we will be putting out solicitation for nominations to potentially fill those spots. I am relatively new, and so, I'm open to remaining in the spot. I think Sarah is potentially as well if we don't receive nominations, but we want to open that for nominations. And so we will be sending out the co-chair nomination call via the listserv after this email. If you have any questions about that, please reach out to the three of us, and we'd be happy to kind of discuss. Anything to add on the co-chair nomination piece? I think that was easy. Yeah, okay.
I think that just the nominations, the deadline for nominations will be in the paperwork. And I think the next meeting would be the first meeting of the new co-chairs.
The next
Okay.
meeting would be in August, and I think that we're gonna open the nomination period for about a month, and then we would announce the new co-chair. We do the transition at the next meeting in August.
Yeah.
And so keep an eye out for that. Let us know if you have questions. The other kind of item that we wanted to bring to everyone's attention is that we are very curious and interested in people's experience of CC Habs, and we're just kind of evaluating, how we're running things and if it's still working and if people like this format and why and what people are getting out of CC Habs meetings and what they maybe want to be getting out of it. So we've put together a survey for the CC Habs group. So we'll go ahead and actually put that into the chat right now if you want to kind of take a look. I'm going to go ahead and just kind of draw your attention to a couple of specific elements of this. So this is it's just a Google Doc or Google form. Most of the answers are optional, so we're happy to get most of your, whatever information you're willing to share. We're just trying to understand people's how often you've been attending, how long you've been attending, your roles, and maybe your motivations behind attendance. We have a couple places where we want to make sure that we are engaging the right groups in the CC Hub content. And so this question here, just drawing your attention of if do you feel that we're doing a broad enough outreach? Should we be doing additional outreach to other groups to attend these meetings? These are some more questions wanting to draw your attention here to we've been chatting about whether or not we want to continue with the quarterly meeting format versus some of the other working groups meet more regularly for shorter periods of time, and whether or not that is more desirable or people that fits better with people's schedules, doing a 1 hour meeting more often than a 3 hour meeting. Questions about some of the content and things that we've been doing. Do you like it? Are there other ideas or things that you would like to see? And some questions about our work groups. So we have several working groups. They provide us with regular updates and they meet regularly. For example, the benthic guidance work group meets very regularly right now and is working on products. So, and we report back to the larger network on a pretty routine basis. Those types of working groups we have the main ones are the benthic mitigation and illness work group. The illness work group has limited membership, but they kind of report their findings back to us. But there's always opportunities and interest on the co-chair side to facilitate additional working groups if there's enough group interest. And so if there's any ideas, for example, we've had people ask us about equipment sharing and use. And so would there be interest in having a working group around monitoring equipment, for example, and some open response here for you guys to share your ideas. So with that, we have that in the chat. We'll kind of spam you with that. We're going to go into a break. So maybe if you want to fill that out while you drink your coffee, and we'll go ahead and send that out via email as well and give about a month for everybody to answer that. So if that all sounds good, did I cover everything, guys? Okay.
Yeah.
Great. So if that all sounds good to everybody, we'll go ahead and move into our break. We'll take a 15-minute break. So go ahead and get some coffee, drink some water, have a snack, and we'll be back at 10:45 to have updates from our subcommittees, and then we'll go into monitoring updates from our monitoring partners around the state. So thanks, everybody, and we'll go ahead and start our break period. Hi, everybody. Welcome back from break. Hope you all got some good caffeine and hydration. So just moving on with our agenda here. Up next, we have some updates from our working groups. And so on deck, we have the benthic subcommittee and the illness work group. So that would be, I believe, Carly, you were going to give the benthic update. And then we had Shannon next. So Carly, if you want to take it away, I can see your screen. Everything looks great.
Well, thanks for sort of priming this in your earlier discussion about the work groups. So I'm just one of the members, but I'm going to give the presentation today. So with that, I'll get started. So the reason the benthic work group came together is we were looking at our current SOPs, standard operating procedures, and the signage recommendations. And the North Coast has done a lot of research the last couple of years and looking at their benthics. And so we thought it was a good opportunity to sort of reopen the book on that and evaluate the current science and see what's appropriate and what may not be appropriate and come up with some new ideas to present. So we reconvened in May 2023 just to kind of get the group together and start having the discussions. And then we paused for the field season for obvious reasons. We all got really busy. And then reconvened back in October of 2023. And we've been meeting fairly regularly, about monthly, since then. And then we have meetings planned through May of this year, thus far. And we have about 10 members. As I said, North Coast has been a really great advocate in this work group, bringing a lot of expertise, but we've also brought in some other states and US EPA. So it's been a really diverse group. And honestly, I feel like I've learned a lot. Jamie's also part of that work group. So it's been really insightful with a lot of great members. And so what are we doing? So we're kind of following with like this one guidance question, which is, should human use or domestic animal use be restricted in a water body due to the presence of benthic HABs? So that has been our main focus in trying to answer this question with what the monitoring would look like, and then whatever corresponding signage would look like. So we kind of expanded these goals to look specifically at immediate event response that follow-up monitoring if it is being done. So if an incident is reported to us and then they go out and do that initial monitoring, if they're doing follow-up monitoring to then inform future signage. And then also if there's just a routine monitoring program that's occurring throughout the summer months or the HAB season. So we first started with conducting a literature review of the latest science and the existing field protocols to kind of give us some baseline and some guidance as to where we might want to go with this. And then from there, we kind of like parsed it out to look at indicators of what indicators we want to actually be evaluating for determining, you know, if a water body has a HAB and if we should be restricting any kind of recreation. So the indicators we decided to be looking at specifically is coverage. So how much of the mat is there, cyanobacteria presence, and what genera, and then as well as toxins. So those toxin productions. And we quickly realized that it's not, you know, black and white and not very simple. So we really are kind of evaluating this grab bag approach in terms of different types of monitoring, how frequently, and then the different indicators that are being monitored. So this is just kind of a cool flow chart that sort of puts all that information together in a succinct way. But so we sort of have this different types of monitoring and then how they fit together and how they determine whether we're posting or deposting based on that type of monitoring, as well as if there is no additional monitoring. So as we all know, monitoring is expensive and involves a lot of staff time. So oftentimes we have that immediate incident response, but then there's not that follow-up monitoring. So we really wanted to account for that as well. Okay, and so these are just a table of the different indicators that we're considering right now. So one is coverage. And so we're looking, and this has a big asterisk with it, because this is assuming we have a standardized approach for evaluating coverage, which we currently do not, with a fixed spatial scale, and then as well as that level of effort identified. So we're looking at like percent cyanobacterial coverage, whether that's based on like binning things, and or looking at things of like size and metrics. So if it's like less than a sedan or a meter squared or things like that, or even just getting a little more rudimentary and looking at presence absence. We're also evaluating cyanobacteria. So looking specifically at the DNA analyses, or just looking at to see if it's present or absent. And I know that kind of fits in with the coverage, but we wanted to make sure that was covered as well. And then as well as microscopy to determine the genera present. And then as well as looking at toxins. So if it has the toxin producing gene with qPCR, or looking at the actual toxin concentrations in the mat material, as well as about integrating the use of spats, which I believe Region 1 presented fairly recently on this to the group in their use of spats, and they've been really successful as a screening tool. And so this is a lot to take in, and I'm not expecting you all to look at this with a fine-tooth comb because it's just an example. But we're really trying to focus on kind of flowing out how this would look, especially evaluating the different types of monitoring. So this is just an example of event response monitoring. And what I really want to highlight is like we have in here if there's no additional monitoring, or if that follow-up monitoring is integrated into that program, and the different indicators that could be included with those, and then what the recommendations would be for, you know, posting and deposting. Over here we have the deposting, and then as well as some examples. We're not tied to anything, we're still really trying to figure this out as to like what we want to consider for corresponding signage, but some things we have been considering is integrating a QR code for folks, and then as well as highlighting if a water body is visited frequently or not. So just some things we're considering. We're still parsing a lot of this out, but I just wanted to provide an example. So next steps. So we haven't really dove in quite yet, but we're gonna be looking at coverage assessment protocols I mentioned earlier, and trying to find something that works for us in the state, especially with different expertise and time allotted for staff to go out and do that. We don't want it to be so onerous that folks won't do it. And then we also want to define what we consider recreational sites for what should be targeted for monitoring. and then evaluating as well as I gave an example for event response and that follow-up monitoring, but we also want to look at routine monitoring. And then from there, we're going to consolidate all of these ideas and input that we have going around with the group and present it to the greater group here at CC Hab. So we're not really at a point yet to present anything concrete to get some input from the group, but we will be circling back because we would really like that input from everyone. And with that, that's all I have.
Awesome. Any questions for Carly? Perfect. All right.
Thank you.
Thank you for presenting for us, Carly. All right, Shannon, I saw you already put some things in the chat, but I will hand the reins over to you for the illness work group update.
Great, thank you. Nice to see everyone today. Thanks for joining us. Always a great meeting. Love the speakers. Always learn something new despite being in this world for a few years now. So just wanted to say thanks again for all of the wonderful discussions and emails that happened in between the quarterly meetings. We really appreciate that. I don't have any slides to present, but I do want to draw your attention to the chat where we do have links to our updated freshwater HAB and marine HAB pages. So this is again the combined effort of the 4 agencies, OEHA and CDPH being the 2 health agencies, and of course the water board always doing the yeoman's work with all of the field sampling. And CDFW is helpful with not only additional laboratory resources, but in the wildlife cases. So a couple of things of note. Minor changes this year to our freshwater HAB page, just a couple of clarifications. And then of course we added in the new data for 2023. To date, we have 6 years worth of data for freshwater illnesses, and that started in 2018. So we have everything through 2023 posted. And we've had 158 HAB-related case determinations over those 6 years. There's a breakdown on our graphics on our website by humans, fish, wildlife, and dogs. And just for your good to know file, all the human and dog cases are listed as individuals. So you might have had 2 humans report illnesses for 1 event, but they are represented as 2 distinct human cases. So when you're looking at the graphs, the numbers for humans and dogs reflect actual individuals, whereas the fish and wildlife events represent groups. In a handful of cases, that may only be 1 animal, but generally they are representative of entire groups, particularly fish, where we have a large fish kill event. We updated our maps as well. So we have county maps new and updated for showing the spatial distribution of HAB illnesses that have been reported over the last 6 years. As has been done before, we have 1 cumulative map for 2018 to 2022 and 1 that's just for 2023. And then we also show the distribution of those illness events over the course of months. And no surprise to anyone, we have an uptick in reports and confirmed illnesses that happen in the summer months when people are more likely to have contact with water. However, there is not a HAB season in California. We can have HABs year round. And so we've had incidents in January and February and November. So we're always aware that it is a possibility. And I just wanted to bring your attention to for the marine HABs. Unfortunately, last year was a very devastating year for our marine mammals. We had over 1,000 stranding events between the pinnipeds, so mostly California sea lions, but we had a few other fur seals and other species, and then about 100 dolphins. So that was due to domoic acid off of the Southern California coast. If you're interested in more details about that, I'd be happy to talk to you. You can email me. Just wanted to bring those updates to your attention. These HAB Illness Work Group is working very closely with CDC OHABs. Of course, CDC OHABs is the main database system that tracks HAB-related illnesses nationwide by state level. And so we've had a few meetings with them over the last 3 to 4 months just to give some input on how they might consider making some adjustments to their entry forms for reporting illnesses on a state level so that it can accommodate and allow for more detail in the narrative side for input on large mass casualty events, such as what we saw in the Bay Area in 2022 and 2023 with that estuarine marine hab event with Heterosigma akashiwa, the red tide that everybody reported with the mass fish kills. Of course, the sturgeon population being the most impacted. And then also when we have either a mass fish kill event with multiple locations at a large water body, perhaps, and then certainly when we're talking about marine mammals. So the feds have been very, very receptive to our input. They have some new personnel on their team and are eager to make sure that they are responding to the state's needs. We also have had an opportunity to do outreach for a variety of meetings. Tomorrow we will be presenting to the Health Officers Association of California. And so we found that being able to either table at events or also to present a webinar type format discussion with various groups is one of our most effective ways to do outreach and get hub messaging out there and find out what other resources are available. So we're always interested in hearing new avenues to pursue, but that's really where we're at today. So just wanted to acknowledge all of our colleagues. So from the Water Board, it's Carly Nielsen and Marissa Van Dyke. From CDPH, it's Thomas Hayashi, who is here on the call today, and Karen Odkins as well, who's also here from CDFW. And then, of course, I am from OEHA. So always happy to have a conversation if anyone's interested in particular efforts, but just wanted to bring your attention to our newly revamped, updated resources with the current 2023 data. Thanks very much.
Thank you so much for that update. I was kind of following along on the webpage as you were talking, Shannon, and it looks really great. It's very informative. So we appreciate the work that you and the work group do and the regular updates. Okay, so right on time, we can move into the monitoring updates. And so I figure we'll go ahead and start with the state program. If you guys want to do your updates first, and then we'll go region by region, and we welcome the updates obviously from the FHABS coordinators, but if there's other folks on the line that want to provide updates based as we go through those different regions, please let us know, and we welcome those updates. So I will pass this off to Carly.
Me again. Hi there, everyone. Carly Nelson with the State Water Board's FHAB program again. And I might tap in again for some of the regional updates for the regions I can't be here, so you might hear from me again. We don't have a lot of exciting news, but just kind of going through, just want to remind everyone that we are a small but mighty team. It's not just the state board folks. We have, we call freshwater and estuarine harmful algal bloom coordinators throughout the state at each one of the regional boards. The ones denoted in green are the ones that are funded, but we get a lot of support from folks that are unfunded at the regional boards, and we're internally grateful for their help. So they coordinate a lot of that incident response, and then as well as provide trainings to partners and then facilitate a lot of the holiday assessments. So you can find all the contact information here and reach out to your FHAB coordinator at any time, especially with anything related to HABs. They're a great resource. And then just kind of reminding everyone what our program does and resources available is we host a web map where we update it in near real time of different HAB incidences we receive throughout the state, and as well as updating it based on any new information we get. We have a lot of informational flyers, pamphlets, FAQs on how to stay safe. Please recycle, reuse, and send it out to folks. And then we also issue advisories based on the different trigger levels and advisory signage, which I kind of went over a little bit before with our benthic, but we also have planktonic specific signs. They can vary from anything from to stay away from the scum to stay off the water altogether, depending on the severity of the bloom. And then we also have standard operating procedures on how to collect samples, site reconnaissance, things of that nature, just to make sure we're consistent throughout the state in our collections. And then as well, don't forget to report HABs. Just your friendly reminder from your water boards folks is the only way we really hear about it is from the public and from different agencies that share their data. So how do you do that? You go ahead and use their web report form. It's really short. I only ask you a couple questions. One of the new additions is you can now upload documents. So you can upload photos. We're actually pretty good at identifying HABs via photos. So even if you just want us to help you confirm if there's a bloom, use that web report form. We're here as a resource. We'd love to help you with that. And then as well as all that information, then we'll populate our HAB web maps so we can keep the public informed in one repository. And then just putting in another plug, pre-holiday assessments are happening soon. So the water boards promotes and often funds a lot of sites being monitored before the Memorial Day, the Independence Day, and the Labor Day holidays, so that the public has some idea of where it's safe to recreate in a lot of those more popular recreational areas, because as we all know, it's a long weekend. We want to get out and enjoy the weather. So we do enlist partners for that because, as I said, there's only a small but mighty team, so we need a lot of help, as much help as we can get. So just a reminder, if you want to participate, the sampling period for the pre-Memorial Day assessment starts May 6th through the 15th, because we need a little bit of time to get the lab results back from our lab, and we kind of bury him with samples during that time period. If you have data that you want to share with us, we take that as well. So please email the Cyanohab reports inbox right here with any data, and we'd be happy to share it on our web map as well. As well as we're starting on the monitoring season. So we do partner monitoring. So some folks reach out to us when they want to start, as I talked about in an earlier presentation, routine monitoring, not just incident response, so they can be proactive. So if you need more information or training or resources, we're happy to provide and facilitate whatever your needs are, including sampling kits. So feel free to reach out to us. You can reach out to the Cyanohab reports, which will send you to the state board folks, including me, or you can reach out to your regional board contacts. As I said, sampling kits are available. We promote it. And then if you do this QR code, that'll send you to our partner monitoring wiki, which has a ton of resources, including videos on how to do sample collection, as well as like abbreviated instructions and things of that nature. So please visit it, email, ask questions, all the things. And with that, that's all I have for us.
Awesome. Okay. All right. Well, then we will move from north to south. So starting with Region 1, I think, Mike, you had some updates and a slide deck. So you should have your screen sharing enabled if I did everything right here in the background.
Okay.
Perfect.
Can you see that?
Yes, looks great.
Okay, thanks, Jamie. My name is Mike Thomas. I am the FHAB program coordinator for the North Coast region. I work closely with Rich Fadness, who is our swamp lead. So just to give you an idea of some plans for 2024, routine monitoring in the Klamath Basin. You may have heard there are some things going on, such as dam removal. So things are looking a little different this year, but there will still be some biweekly microsystems monitoring. And this is in coordination with the Tribal Water Quality Consortium, as well as the Klamath River Renewal Corporation. In Big Lagoon, there will be biweekly microsystems monitoring again. And this is a collaboration between Big Lagoon, Rancheria, and the US EPA conducting analyses. The Russian River, we have Sonoma Water out there doing biweekly cyanobacteria identifications. We are also participating in the pre-holiday assessments. So just listed here in the table are the water bodies that will be sampled and the entity responsible for collecting those samples. For about half of these, we are pushing out the sampling events to include that post-holiday event to capture blooms later in the season. But a few we will be sampling 4 times. Some other things going on in the region. We will again be participating in the US EPA ROAR project for the 2nd year. Basically, we are trying to assist US EPA in developing standardized benthic sampling methods. We did a lot of different kind of sampling last year, but this year it sounds like we will be kind of honing in on more specific protocols. We are also collaborating with the University of Nevada at Reno, looking at the spatial variation in antitoxin production within and across river networks in California. And they are interested in looking at the influence of various river and watershed factors on antitoxin production. Benthic monitoring, we continue to recommend to our partners to use the tiered approach, where we recommend deploying spats as kind of sentinel samplers for determining when cyanotoxin production is increasing in the river system. Once you see those increases, you would then conduct visual assessments and look for and do an estimate for cyanobacteria percent cover, and then mat collections to confirm toxicity. We have brought this approach as well as data from 2 pilot studies over 2022 and 2023 to the benthic subcommittee, and we are incorporating these into potential revisions to the guidelines. And just an announcement for trainings this year in the North Coast region. We will be hosting virtual and field trainings again this year. The virtual training will be on August 7th via Zoom. And then we'll have 3 options this year to do trainings in the Klamath Basin, the South Fork Eel River, and the Russian River. I will be following up with an email to our partners, but just go ahead and maybe save the dates for these. Again, these are just 3 options for the field trainings. You do not need to attend all 3. But we are welcoming all partners. So if you're interested, please shoot me an email. And here are all of our partners. So thanks to everybody for their participation.
Awesome. Thank you so much, Mike. Any questions for Mike? And if not, we can start to or anyone else in region 1 that wants to, the North Coast region that wants to provide an update. Okay. Not seeing anybody. Okay. So then we can go to region 2, which I believe, Carly, you're giving the, if I'm remembering correctly, you're giving the update on their behalf.
Yep, that's me again. So region 2 is the San Francisco region, which is right over here. Their field staff are out in the field today, as they should be. So just to highlight, in 2024, they've had 2 HAB incidences thus far, one at Lake Hennessy and then one down here at Lake Merritt. It was suspected red tide, but they dissipated, both of the incidences dissipated pretty quickly. They have a really robust response program now after the 2002 incident or 2022 incident. So they mobilized really quickly to get out and grab samples and identify if it was freshwater or marine, and then as well as just regular visual monitoring to see what was happening. The Lake Hennessy triggered a caution advisory. And then, as I mentioned earlier, all the regions are ramping up for the pre-holiday planning. So this is where Region 2 is hoping to visit this year. They have some support from the Napa Institute and the Sonoma Ecology Center as well as partners. And then they're also doing a little bit more of a robust partner monitoring program at Lake Merritt, because the 2022 Marine bloom actually went into Lake Merritt, and then Lake Merritt has also known to have freshwater cyanobacteria present as well. So they have partnered last year and again this year with the Rotary Nature Center at Lake Merritt, and so they do monthly sampling, as well as just visual monitoring, and then the regional board will do any incident response based on the results, the data. And then I don't want to take the credit for East Bay Regional Parks. I don't know if Hal McLean's here, but they have a really robust monitoring program at East Bay Regional Parks, and they're a lovely partner to work with, and they share all of their data with Region 2 and with State Board to make sure we can put their data on our Have web map so we can have a consistent messaging to the public. And with that, that's all I have for Region 2.
Awesome. I don't see anybody on the line, unless I'm missing them. Anybody on the line from East Bay Parks, as I know they normally provide.
Hi, Sabrina Sexton from East Bay Parks.
Okay, there you are. Okay. Yes, you're well. Do you need a screen sharing or?
No, I don't have a PowerPoint. I'll just give a quick little verbal update. Okay, so we are gearing up for our swim season, and unfortunately we are starting that out with danger advisories at Horseshoe Lake at Quarry Lakes, Lake Temescal, Lake Chabot, and Delphal. And we have caution advisories at Shadow Cliffs Lake and Lake Anza. We've been fortunate enough to have somebody in a new lakes management position, Anya Bry, who has been coordinating treatments at Lake Temescal and Lake Anza. So since March, we have had, let's see, I believe 3 treatments at Lake Temescal, varying from Utrazorb to dye treatments. And then we've had 2 treatments at Lake Anza. Like I said earlier, Temescal is still at a danger, so those treatments haven't quite been enough to nip our blooms in the bud, but Anza was able to go down to a caution from a danger earlier this year. So yep, we are up to our weekly monitoring because it is swim season now, and continuing business as usual.
Awesome,
and that's it.
Awesome. Yeah, we appreciate the update. Let's see. Anyone else from the SF Bay area? If not, we'll go ahead and move down to the Central Coast.
I don't think Melissa's here, so this is Carly again.
Yeah.
So Region 3 participates in the holiday assessment. They tack it onto their regular monitoring program, so they go out to 10 different sites for the pre-Memorial Day. So they'll have, and those are some of the more popular water bodies that have reoccurring blooms often, like Osoflaco Lake and things of that nature. So they'll be doing that for this pre-holiday assessment as well.
Anyone else from that area? Because if not, Carly, you might want to just, because I don't see Emily on the line, if you wanted to do, I don't know if there's any updates from Region 4, which is the Los Angeles.
Yeah, so Region 4 actually this year is going to be a little bit more robust with the holiday assessments, which is really exciting. So we've been training LA County and City of LA. So they're going to participate in the holiday assessments and collect samples at multiple different sites at regional parks and then some of the other larger lakes. So we're excited to gain some new partners this year.
It's very exciting. Awesome. Okay. All right, if no one else from the LA region, we're going to bounce back up now to Region 5, which is the Central Valley. And I don't know. So I see Dana on, and then I saw Sarah. I don't know who wants to go first.
I'll follow Dana.
Okay. All right, Dana, it's all you.
Okay. I don't have slides to share, but I can give you an update on some of our plans for the upcoming summer. So for holiday assessment, we have a mix of sites that are funded through the program and groups that are just sharing data for the effort. So we expect to get data. Restore the Delta is going to sample a handful of sites around Stockton. Tulare County Environmental Health is going to sample Kauai River and Lake Kauai. Our water board Fresno staff is going to go out and sample Hensley and Eastman lakes. And then there's a few efforts around Davis and Tuolumne County that we expect to get data from as well. So that's our holiday assessment. And then looking forward to projects we have going in the upcoming year, we're planning to continue our partnership with Restore the Delta in the Stockton area. And we're also planning to do a special study with Tulare County environmental health staff to sample Kauai River and Lake Kauai. Awesome. And those are my updates.
Thank you. Sounds like a lot going on. And Sarah, I'm sure Clear Lake always has a lot going on.
Yeah, hi everybody. So I'll be reporting on the Clear Lake and also other water bodies in the Lake County cyanotoxin monitoring program. I work for Big Valley Band of Pomo Indians, and we've been working on this program and basically doing water monitoring, microscopy to identify the genera of cyanobacteria, sending off for toxin analysis, fish tissue analysis, and water chemistry at the sites. So we, in the wintertime, we just go out to about 10 sites, and we are out there just monthly. Our last lab results that we got back from the March 19th sampling event, there were toxins, but everything was below the 0.8 micrograms per liter. So for all 3 sampling events that we've had in 2024 so far, we've had no detects of toxins over the 0.8, which is not surprising. However, we do think that this next sampling event, we are going to we're going to be seeing some things, because we are seeing blooms, small blooms or cyanos present in 8 sites from our sampling event yesterday. The microscopy is showing primarily a Famazamenon and Gettleronema. We're still not seeing a lot of microcystis, but we have been seeing microcystis a little bit in some of these sites. We just got back, and maybe it'll I'll be able to present on it more soon, but we just, or another meeting, but we just got back our cyanotoxin fish tissue testing results for, I think, 48 fish from multiple locations in the Clear Lake watershed. And I believe out of the 48, we had about 30 that had tissue, not liver, tissue microcystin result values. The highest result value we got for microcystin was, I believe, a 7.01. It's like 7.01 micrograms per liter of microcystin in the tissue. We have a variety of fish and shellfish composites that were sent off to the labs. So we will have more to report on that later at a future meeting. And then the other thing that we're engaged in is spat bag analysis and use of spat bag and grab samples for creek benthic cyanobacteria monitoring, cyanotoxins. And although we're showing some detects of Cylindrospermopsin and anatoxin, most and of course seeing some cyanobacteria in benthic cyanobacteria in the grab samples. For the most part, we're seeing a lot of non-detects in the creeks. We've got about 8 creeks tested so far, and it's always a crapshoot because the creeks might be dry by the time we get out there. We are seeing, and some of our sites are repeat sites from previous years. We're in our 3rd year of ambient creek monitoring for cyanotoxins and the use of the spat bags. So we're going to be participating in the FHAB program, sending off a few samples through for the holiday pre-assessment, and we'll be starting our twice a month cyanotoxin monitoring starting in May. So this coming month we're starting early. There's already been, we've gotten calls from property owners about blooms that are along their shoreline. It's primarily in the Clear Lake area, so that is in the actually in the lower arm, and I've seen it, and yeah, we're seeing famosamenon, and I believe we're just doing microscopy right now. It's very dark green bottles of water from those sites. So we'll be sending off the samples for analysis today for samples we did yesterday. And I think that's it. Thank you.
Great. Thank you, Sarah, and thank you, Dana, for Central Valley updates. I don't believe there's anyone else on the line for that region, but if so, give me a shout. Otherwise, we'll move over to Region 6, which is the Lahontan region, which is the Sierra Nevada and foothills. So that would be Sabrina.
Hi, everyone. Can you hear me?
Yes.
Hi, I'm Sabrina Rice. I'm the coordinator for the Lahontan Water Board office, and I did not put together a slide, but I'll just kind of go over what we're planning to do this season. And also we've had one bloom report so far this season. It was for a river in Alpine County. We did test that area, and we thought it actually was going to be, it looked red, so it looked kind of more like the iron oxidizing bacteria, but we actually did have quite a few detections through qPCR of cylindrospermopsin, but there were no toxins present. But that was kind of an interesting one so far this season. And then we are going to participate in the pre and post holiday assessments. A lot of the blooms we see in our region tend to be later on in the season. So we're doing quite a bit of, or we're not going to do this first assessment. We're going to do another testing sometime in like October, September instead. And we have probably roughly 20 water bodies we'll be monitoring during those assessments. And as always, thank you so much to all of our partners who participate in that. We could not do it without you. And we will also be continuing our partner monitoring program with Inyo County this season. That will be monthly monitoring at Diaz Lake and Mill Pond. Those are near the Bishop area, if any of you are familiar. And then we're starting a new special study. We're going to do a benthic stream assessment on 2 systems, and we kind of picked these systems based off of the data that was collected from the CDFW bioassessment program over the last few years. We're going to be looking at the Little Truckee River and Big Meadows Creek. The Little Truckee River is up near Prosser Creek Reservoir, kind of in the Sierra and Nevada counties. And then Big Meadows Creek is in El Dorado County near South Lake Tahoe. And we picked these areas based on the level of toxins that were present during that monitoring, as well as the level of rec use seen and the proximity to our office, since it's just kind of our first year doing some benthic monitoring. And I also had surgery this year, so we're trying to make that a little easier for me to just access those areas. And yeah, I think that's it from us.
Awesome. Thank you, Sabrina. Okay, so then up next, if there's no one else on the line from Lahontan kind of general area, we'll move to Region 7, which is Colorado River region, and that would be Jeff. I know, Jeff, you had some slides. If you want to share those, you should have the sharing capability.
Okay, can you tell me where to find that?
You should have that down at the bottom. There's a green button with an arrow pointing upward that says share screen. It's either going to be probably on the
yeah, thank you.
Computer. Yeah, perfect.
All right. Can you see my slide?
Yes, looks great.
Great. All right. So I'll just start off with our holiday assessments. Our budget allocations for HABs have been reduced, and so our HABs work is generally limited to incident response and also holiday assessments. This Memorial Day weekend, we'll be doing 2 sites at Salton Sea, 1 site at Lake Cahuilla, different from Dana's Lake Cahuilla. I didn't even know there was another one. And we also have a new partner monitoring site this year from Weast Lake, and Imperial County will be conducting that sampling. We had a lake-wide bloom there last year, that resulted in a pretty big fish kill. So they want to follow up on that. Go to the next. As far as incidents, we had another incident at Salton Sea, Bombay Beach. There was an illness reported from someone who had been sitting on a sofa that was sitting in the shallows of the sea, which, if you're familiar with Bombay Beach, you know that's perfectly normal behavior. So the person ended up with this red scabbing and bleeding on his legs. It was inconclusive, though, because he had done other activities in the meantime, including he had visited a spa, and OEHA seemed to think that maybe the temperature had a role in maybe exacerbating it or whatever. So it was inconclusive in the end. There was no follow-up monitoring, only because we already know that Salton Sea is in a perpetual HABs bloom, and so there was no monitoring after that. And finally, the upcoming work that we have, Region 7 HABs was awarded funding for a special study by the FHABs program. We'll be collaborating with USCPA's Office of Research and Development, as well as Arizona's Department of Environmental Quality, the Arizona Center for Algae Technology and Innovation, and the Kemwebi tribe. We'll be conducting the first phase of a long-term adaptive study that's being carried out at Lake Havasu, as well as the lower Colorado River just south of Havasu. In fact, I'll be going out next Tuesday for our first sampling event. And again, this is going to be an ongoing, multifaceted study. And that's about it. But I did lastly want to acknowledge our FHAT program coordinators, Marissa and Carly. They've been a pleasure to work with. They're extremely helpful, supportive, they're responsive, they accommodate everything. And I don't think the regions would be nearly as involved with HABs if it weren't for them. So just want to thank them for their support. Thank you.
Looks like Sarah raised her hand. Sarah, do you have a question for Jeff?
Yes, quick question, or 2 questions actually. One is the what kind of, when you do cyanotoxin analysis at Salton Sea, what kind of numbers are you getting? What toxin are you seeing, and what kind of result values?
It really varies, but it's kind of interesting in Salton Sea because sometimes we'll find the absence of toxins in the water, but then we'll find them in the algal mats, sometimes exceeding the protocol levels. It varies, but we usually end up issuing at least a caution level protocol. Sometimes it'll go to a warning level. We've had a couple of danger levels for anatoxin, and we've had the dog deaths and things like that. Yeah, I don't have specific numbers offhand.
Okay. And then my other question is, I understand that Lake Havasu has quagga mussels, Dracaena, what do you call it? Basically, they're contaminated with these mussels, these invasive mussels, and we're trying to prevent them here at Clear Lake. And one of the things we've always heard is that cyanobacteria blooms tend to be worse in water bodies that have these invasive mussels present, because of how they filter out the they filter out the water for either filter feeders, and what's left is really there's nothing to compete with cyanobacteria. And I'm just wondering if there's any going to be any attention paid to that with the monitoring that's going to be happening at Lake Havasu, or if you already have some ideas about that.
Yeah, the focus of this study is pretty narrow, so I don't think we'll be including that. But to your point, there's a gentleman, Taylor Weiss, who's with ASCADI, the Center for Algae Technology, and he's part of ASU. He is working with us on this project, and he's very familiar with the quagga mussel situation. So, I mean, it's crossed our minds, but I think we're just going to keep our focus narrowed because, again, this is our pilot part of the project, and we're just getting our feet wet, so we want to make sure that we cover all our bases before we jump in deeper.
Yeah, maybe that's something to for a future study. That's certainly what we've heard over here. All right, well, thank you very much.
Thank you.
So thank you for those updates and that conversation. It's super insightful. So then moving along. So Region 8, I see that Kirk is on the line. If you want to give an update.
Yeah, Kirk Larkin, Hab Coordinator for the Santa Ana Regional Water Quality Control Board. Don't really have a whole lot of information to report for our region. It's been relatively quiet with the recent rains we've had. I think it's increased the lake levels. So that's a good thing. Hope we cross our fingers it will continue on that trend as we go into the summer, but likely not. With monitoring, we're going to participate in the pre-holiday assessments, reaching out to the similar water bodies we've done in the past, previous years, focusing attention at Big Bear Lake, Lake Hemet, Lake Elsinore. And we're also incorporated a couple of monitoring sites this year as well as last year, where we were looking at Mill Creek, and we're going to look at potentially Lila Creek as well. Looking at potentially for benthic mats and those locations. Those two creeks have recreational water use in the summertime, so it'd be good to get some data on that. Don't have a whole lot of data on that, so it'd be good to get some more information. Continue to respond to bloom reports as needed. So if those pop up, we'll allocate time and resources to go out and respond and collect samples if needed. At this time, we don't have any routine monitoring that we're managing. We don't have a special study active as well. So we'll continue to, like I said, respond to incidents that pop up. One thing to note too is with the lake levels coming up with rising at Lake Elsinore, the recent monitoring that's been collected on behalf of the city by the consultants, they actually have had no toxin detections in terms of they've been low enough that they're below the caution advisory. The lake, as my understanding, is still posted just for general awareness, but in terms of the data, is looking good, which that lake has been chronically prone to have algal blooms and toxin production. So that's a good thing. So with that, I think we always have some additional monitoring that's coming in from San Bernardino County parks. So we'll see if that data pops up. But that's all I have to report.
Thank you for that update. Really interesting to hear that Lake Elsinore is actually under the advisory level for first time in a while. Yeah, so it'll be interesting to see how that progresses throughout the summer. Okay, and I think then moving to Region 9, so San Diego, Carrie had a PowerPoint for us, so you should have sharing abilities.
Let's see. All right, can you see that?
Yes, looks great.
Perfect. There's slideshow. Okay, so I'm Carrie Kowalski, and I'm the FHAB coordinator for Region 9, and my partner, Debbie Woodward, works with me a lot. She's just not at the meeting today. So quick updates. Surprisingly and unfortunately, with the cooler weather and rains, we still have gotten some bloom reports, and the most notable one was very toxic, over 8,000 micrograms per liter of microcystins at Linda Lake. It's a really small lake in a recreational, a regional park area. People bring their dogs. There's a lot of fishing. And unfortunately, Fish and Wildlife were trying to use this lake as a stock pond for like a perch nursery for some reintroduction. So they had to postpone some of their efforts. And we've been working with them a little bit. We've worked with the park rangers at Lindo Lake and got them in touch with some people that we know that are doing some good treatment options. And so they're talking to the irrigation district to learn what they're doing. This bloom was Microcystis and Dolichospermum species. And then this lake is on our pre-holiday assessment list too. So we'll be keeping an eye on it through the bloom season for them. And you had asked about potential mitigation efforts. And so we actually just had last month, our board adopted a cleanup and abatement order for Lake San Marcos, and it deals with other contaminants too, but eutrophication and algae blooms is a big component of it. So with this abatement order, they have to do some risk assessments, identify sources of waste within the stream upstream of the lake and within the lake, and then recommend and implement some mitigation measures, and then identify some remedies within the lake and the creek. And they have done some pilot studies over the years for different treatments, and as well as input an aeration system. So they do have an alum treatment scheduled in June. So we'll keep an eye on this lake as well. And beside the responding to our bloom reports, we'll be participating again in the pre-holiday assessments. We have funding for 5 sites. Probably one of the most exciting sites for us this year is Spring Pond, which is on Viejas tribal government lands. And they've been really wanting to work with us and learn how to do their own cyanobacteria and cyanotoxin monitoring. So we'll use the pre-Memorial Day holiday sampling as a training opportunity for them, and then do the handoff and let them do the rest for July 4th and Labor Day, which I thought was pretty nice. And then we do have a special study planned for this year, and it's basically a small screening study for the smaller public ponds and lakes that haven't historically been monitored, and they're used by tribal and subsistence fishermen and other recreational uses in underserved communities. So we thought that would be a good focus this year. We're able to do 14 water bodies, and 4 of them are actually located on the Viejas tribal land. So with that, I think that's it.
Thank you, Carrie. That's really, really cool. To hear you're going to do that special study. We look forward to kind of hearing more about that in the coming meetings. So, okay. Sarah's got a question, I think.
Yeah, just wanted to make a comment that that's a perfect example. Carrie, that's just so awesome, that news about doing some sampling with the Viejas tribe. And it's a perfect example of how there are so many tribes in California, 109 federally recognized and about the same number of non-federally recognized tribes who potentially have water monitoring programs. There's dozens and dozens and dozens of tribes that have water monitoring programs that might be doing cyanotoxin monitoring or could be updating their program to do cyanotoxin monitoring, get federal funding to do it potentially, and be one of the monitoring partners out there. So I just really encourage that. Over at Big Valley, we've been funded to develop and do cyanotoxin monitoring program training, and basically water monitoring program training with the cyanotoxin element. And the Viejas tribe did participate in that a couple of years ago. So I'm really excited to hear that they're going to be doing monitoring. If anyone has any questions, if there are any HAB coordinators or others on the call who would like to either have some assistance in reaching out to the tribes in their area or want to discuss that further, please let me know. I'm happy to help with that.
Yeah, I may reach out to you offline because we did put a call out to all of the tribes in our region through our tribal liaison, and Viejas was the only one that wanted to participate in our special studies. So if there's, maybe if you have some advice, we can talk later.
Definitely. Yes, let's talk. Thank you.
Amazing. Okay. So with that, if just checking if there's any other folks that want to provide updates. Brianna, yes, Brianna, love to hear from you. Yes.
Hi, I'm Brian Sakata with the California Department of Water Resources, and I coordinate the State Water Project cyanotoxin monitoring. So I just wanted to share that we started our routine monitoring program this week. So we'll have some data to share for the pre-holiday assessments.
Awesome. That's amazing. Okay, awesome. Anybody else want to provide updates on monitoring efforts that are coming up or ongoing? Great. Okay. Good. Glad we got everybody. It's awesome to hear from the variety of partners, including, you know, Brian and East Bay Parks and Clear Lake, and happy to hear these updates. So with that, we dropped the survey link. I'll go ahead and just do it again in the chat here, or if one of my chairs beats me to it. We'd love to hear from you again on the use of this group, and if it's working, what you'd like to see moving forward. Also a reminder that you'll be seeing an email announcement for co-chair nominations. So if you've been interested in that, happy to answer any questions about that. Otherwise, if there's nobody else has any kind of announcements or anything that they want to add, I'll just pause for a second for my co-chairs if I've missed anything. But if not, we thank you for your time and attention today. We have our next meeting planned in August, so we will see you kind of towards the end of the HAB season. We look forward to getting together then. And in the meantime, you'll probably get some emails again about the survey and the co-chair nominations. So thank you all, and have a good rest of your day.